start out. So out of clear blue sky, I started teaching. Let's go back to, I have a master's degree from Quinnipiac in health sciences, Masters of Health Science, with a minor in laboratory sciences. I'm a pathologist assistant. Um, in the old days, and I'll talk to you about pathologist assistants because I'm sure a few of you might have considered becoming or going off to classes and doing pathology assistants. The time when I became a pathologist assistant, this may sound kind of weird, is that you needed to have, you could either be a program graduate or you needed to have a bachelor's degree and all this experience. And you had to be able to document, you could do this and do that, and then take the same test that the students from the program took. And I passed it. So I became a pathologist assistant. And about a couple of years after I got my master's degree, I started teaching, which I really think I should have done this years and years ago. But let me get started on the story. We have to go back a few years, we got to go back to all the way back to 1973. I was 17 years old, and my best friend in the whole wide world, his cousin, somebody, had been in Vietnam and was a medic, a hospital, Navy corpsman. So, and he got all kinds of medals and he saved lives and all this. So I said, oh, that's what I want to be. Here, I'm a 17-year-old kid and I want to be a combat medic, one of those kind of guys. So I joined the Navy, and instead of being a medic, they made me a weather forecaster. I enjoyed that for a few years, but when I got out of the Navy, I still wanted to be a medic. Got a job, went to school when I got out of the Navy, got my EMT license, and started working on the ambulance in Bridgeport. To date it, if you want to date what it was all about, you have to remember we had ambulances that were Cadillac station wagons. There were these huge Cadillacs, and if you ever seen the movie Ghostbusters, you know what they look like. And we were running around. And one day I went to a house fire, and this house fire was a bunch of firemen around, and there was a couple of fatalities up on the third floor. And we went up on the third floor, and it was a couple of children, and they were all they had passed from smoke inhalation before the fire got to them. And we put them in the back of the ambulance because they wanted to get them off of the scene because there was a crowd growing and there was a lot of stuff going on. So we went to the hospital there at St. Vincent's, and we pulled in, and we brought the bodies into the morgue there at St. Vincent's, and I peeked into the room. I kind of opened the door into the autopsy room, and I peeked in, and I couldn't believe what I was seeing. There was this tall, gorgeous blonde woman. Oh, she was gorgeous, right? First thing I did is I'm going to get her phone number. That's what I thought in my mind. That's the kind of guy I was in those days. And then there was this kid standing next to him, this young man standing next to him, and they were just taking the organs out of a body. And I'm like, oh my goodness, look at this. What are they doing? So, I'm all badged out and got all this paraphernalia hanging off of my uniform, all macho looking, come walking in the morgue there, looking at what they're doing. And I said, so what are you guys up to? Who are you and what are you doing? So the guy was, the tall blonde woman was an autopsy tech. And the kid standing there said he was a PA student. Now I'd heard of physician's assistants, but I had never heard of pathologist assistants. Now this is way back in 82, 83, when there wasn't a whole lot of pathologist assistants around. And it was about at that moment I said to myself, I really want to do that guy's job. I want to be a pathologist assistant. So as things turn out, I ended up working on the ambulance, and I ended up getting hired at St. Vincent's medical center in Bridgeport as an autopsy technician. Didn't know my, you know, didn't know from anybody what an autopsy technician was. I just thought it was cool. I know there's some of you in the audience that probably think it's cool to be in forensics, you know, and you get to run around and be in the middle of the crime scenes and cops all over the place, and firemen, there's all that excitement and that adrenaline going. And it is, let me tell you, you'll get whatever you decide to go for your future, you will be in those situations where your adrenaline gets going and you're right smack dab in the middle of everything that's happening. And for some people, for most people, people like us, that kind of thing is good. That's a good thing. I'm sure there's some folks amongst you that are maybe lab focused people who just want to work in a lab. But even working in a lab, you're going to get a lot of excitement getting forensics. So little did I know I was going to throw myself into forensics. I started working as an autopsy technician. And in those days, you know, today, this is the learning part of this presentation. Today, we have a medical examiner system in Connecticut. And the medical examiner's name is James Gill. And the deputy chief medical examiner is Maura DeJoseph. Now, Jim Gill is an MD, a doctor, you know, straight up MD, pathologist. Maura DeJoseph is a DO. She's a doctor of osteopathic medicine. So there's two ways you can become a medical examiner, okay? Those two ways are to be an MD or to be a DO. So if there's any in the group that are interested in going on to medical school from where you are, you have a whole nother option of the types of medical school you can go to. You can apply to the doctor of osteopathic medicine. I'm not saying it's any easier to get into it, but with MD, they graduate all kinds of specialists, and there's not a lot of people who are focused on family care. The DO, the doctor of osteopathic medicine, is really focused on family care, you know, and a lot of medical examiners out there are DOs. If you want to become a pathologist and become a medical examiner, you got to go to medical school. There's only two types of people in this country, in the United States anyway, that can do autopsies, legally can do autopsies. And that's the pathologist, whether they work in a hospital or whether they work in a medical examiner's office, and a pathologist assistant. Now, technically, a pathologist assistant, they have to do the autopsy under the supervision of a pathologist. So what does that mean? Well, the level of supervision that pathologist assistant has to work to do an autopsy is that they have to be able to get a hold of the pathologist if need be. That's the level. There's different levels of supervision. Like when a pathology resident first gets out of medical school and gets in the pathology program and starts learning how to cut surgicals and do autopsies, they have to be directly supervised. In other words, either a doctor or a PA has to be in the room with them while they're doing the autopsy. For PAs, you can for the first 9 autopsies or something like that. For PAs, you can do autopsies. As a matter of fact, PAs do a lot of the autopsies in the hospital setting. So getting back to where I was in the early 80s, the medical examiner's office was run like there was a medical examiner in Farmington. And Farmington in those days was an old big building called the Quonset Hut from World War II. And the doctor, the pathologist who ran the medical examiner's office in those days, her name was Galvin, Dr. Galvin. Now, many of you, probably none of you have ever heard of Dr. Galvin, nor the situation she was in, but the state got all crazy because she had 2 huge Doberman pinchers. And she used to bring the Dobermans to work, and the Dobermans would be running around the autopsy room, and it was a mess. It was a mess. You can imagine the things that people were saying. But we also had what was called associate medical examiners. Now, there's no associate medical examiners in Connecticut anymore, but an associate medical examiner was a local doctor. Didn't matter what field they were in. They could be psychiatrists, they could be pediatricians, they could be cardiologists. Local physicians would get trained minimal training in forensic, like the course that I teach, they would take a course like that, and in forensic pathology, and they would go on to be the medical examiner in local towns. And so I stepped into being an autopsy technician, and the next thing I know, I'm assisting the medical examiners at death scenes, and I loved it. We would go in, and there would be every form and manner of dead body, whether it be decomposing or somebody got all shot up or all stabbed up. My adrenaline went nuts when I was in the middle of all that kind of stuff. I went crazy. I was just like, everybody wants to be me, and I was running around like crazy, and did that for a couple of years, and then ended up working, getting a full-time job as a lead technician at Yale University School of Medicine. So what did we do? What did I do at Yale? Is I was there for about 3 or 4 years. I was going to school at night. I got my bachelor's degree. And next thing you know, the manager of the morgue and the autopsy service had 3 or 4 autopsy technicians, myself, and we handled, in those days, we used to handle about 1,000 bodies a year. When I retired 30 some odd years later, we were handling 2,000 bodies a year. And so what did we do? What did I do there? Well, as a PA and as a manager, I ran the morgue. We handled, like I said, about 2,000 bodies a year. We did about 300 autopsies, medical autopsies. And we also trained people how to do autopsies. So who were we training? Well, we were training the residents, the medical the pathology residents from medical school. Jim Gill, Dr. Gill, he was a pathology resident in, I think, 89 or 90, and I trained him how to do autopsies. There was medical examiner, Dr. Joseph, I trained her how to do a medical examiner. So I had my hands in a lot of medical examiner stuff. The Clear Blue Sky started teaching. I went to, did my first class, 52 students, like I mentioned, and had a ball doing it, and then created the undergraduate course, Forensic Pathology. Tim Palmbach and I were talking when I first started, and he wanted to get a forensic pathology course for undergrads. So I basically took the medical legal course, massaged it a little bit, put some stuff in it, some of my experience, because I spent, students in my class will attest that I throw a lot of stories in there. And when the stories are true, I mean, and a lot of the pictures I use are pictures I've taken either in the field or while I was doing autopsies. So what does a pathologist assistant do anyway? There are 9 programs in the country. All of them are master's programs, and you apply to it like you would have to be qualified to apply to medical school. They're tough programs to get into. But what do? Pathologist assistants are classified as what's called physician extenders. So you've probably heard of physician's assistants. Now these are PAs, physician's assistant. You'll see PA-C. That's a certified physician's assistant. And you'll walk into a doctor's office and you think you might the doctor might be working on you, but in actuality, it could be a physician's assistant or it could be an APRN, advanced practice nurse. Pathologist assistants, pathologists don't routinely see patients. All their work is either in the surgical lab, in the medical lab, or in the anatomic pathology department and in autopsy. The medical lab consists of med techs that do just like forensic lab, toxicology, microbiology, and all that. Thing you won't find in a medical lab is things like ballistics or machine on tool marks, that kind of stuff, fingerprinting. but you have the same sort of scientists doing the tox and the micro and the like. In anatomic pathology, and in the lab there, the doctor works with the med techs to do all their things. In the surgical lab, you've got the doctors, the pathologist assistants, and the techs, the tissue grossing techs, they call them. And then you might have histology. So what is that? The doctor is a pathologist or a pathologist in training. The PAs are in there either on the line or on what we say on the bench, or they're training residents. And then you have histologists who are doing histology, and histology study tissue, and that's where they make the microscopic slides. Everything is from the slides. Everything is, all the pathology is based upon what you see microscopically. And then you get anatomic pathology. Anatomic pathology, you do a lot of microscopic work, but you also do what's called a lot of gross work. And gross means what you see by eye. You know, gross the word gross in pathology means what you see by eye. And in autopsy, you have to make a lot of gross examination before you do your microscopic examination. It's all about that. So anyways, back to being a PA, you have to apply to the programs. Now there is a program here in Connecticut at Quinnipiac. It's a great program. It's one of the better programs. You know, they have a great test success rate. Their pass rate is very, very good for the exam, the certification exam. They have a 2-year program, and the first year is all didactic, where you sit in a classroom and go through pathology and anatomy and, you know, pharmacology, everything you would need to know to understand disease, the process of disease, or understand trauma, and from the forensic point of view, damage that happens to people's bodies. Then in the second year, they rotate through all the hospitals and the medical examiner's office. They'll spend a couple of weeks at St. Vincent's, a couple of weeks up in Hartford, a couple of weeks here, a couple of weeks there. They go all over the country, actually, some of them do, and they learn how to cut surgical. So what does cut surgicals mean? Well, everything that is taken out of the body by the doctor, by the surgeons, is supposed to go to surgical pathology for examination. So you get your appendix out, you get a tumor taken out, you get a little, you know, anything at all where they remove tissue from the body, except maybe bullets and the like. They'll do what's called a gross and a microscopic examination. Some things are gross only, like a bullet. You get a bullet out of a patient, you know, patient goes into the ER with a gunshot wound. They work on the patient got a chance to live. They'll send them up to the OR. In the OR, they do the surgery. They take the bullet out, plunk. That goes to pathology. The PA will grab the bullet and do what's called a gross exam. They say received is a cylindrical metal or metallic object measuring 3.5 by 3.5 centimeters or millimeters or whatever. And then what will happen is later on, the police, if they want it for evidence, the police will come by and pick it up for evidence. The other thing is whatever tissue is removed, like cancer, any reason to have tissue removed. One of the biggest jobs in surgical pathology is the breast service. Many nodules and, you know, biopsies and partial mastectomies, full mastectomies come through there. Fetuses come through there. Everything you can imagine that would be removed during surgery. And the PA will, what's called gross. Now it's being called a verb. They're going to gross to tissue. So they'll take the tissue, they measure it, they take pictures of it, they describe it, and then it's cut so that the best representation can be seen under the microscope. And there's certain ways to cut every piece of tissue that you get. Okay, you cut a piece of, if it's a kidney, you want to make sure you include the tubules and the tiny little blood vessels so they can be seen under the microscope. That tissue comes from the OR. There's also tissue comes from autopsy that gets grossed in. Now, usually when I was at Yale, I used to gross in the tissue. If I was busy, then one of the other PAs would gross in the tissue. The tissue would go through through histology and be prepared, and there'd be slides made so you look at the tumor under or whatever under microscope. And some people will say, well, why do you have to look at knife wounds, gunshot wounds, this, that, or the other thing under a microscope? Well, it's all about how things are healing and seeing the reaction to the wounds. So, for example, we have a knife wound, sharp trauma, and it's a cut or an incision. Remember, incisions are made by sharp instruments. Lacerations, a lot of people don't get this, but a laceration is made by blunt trauma. A laceration is made by the stretching and the tearing of skin, whereas incisions is made with a sharp object. Well, when there's an incision made with a sharp object, glass, knife, we usually talk about knives because that's the kind of things you run into in homicides. The body is going to react to that injury. And that reaction to the injury is inflammation. And depending upon the stage and the development of the inflammation and the healing, because the inflammatory process is to heal the body eventually, we can tell under the microscope, seeing the reaction of the body to the wound. So if there's a wound and you see there's inflammatory cells around the wound, then that wound the person had to have lived an hour or 2 hours after the death. If, however, we see a gunshot wound, you take a picture, you take a section, you look at where the damage was through the body, and you don't see any inflammatory reaction, then we know the person died relatively soon after the injury. And that's what the big thing is trying to figure out when a person died. In my class, the last few lessons we've spent talking about how to determine time of death. That could be the biggest issue. When did someone die? A life spent in jail may rest upon whether or not at autopsy you find the right, you make the right diagnosis. That's where a lot of pressure comes on. One of the most pressure jobs, though, as for a pathologist assistant, is what's called frozen sections. So I always got my adrenaline going when I was responsible for cutting frozen sections in surgical pathology, because I would work up there occasionally just to keep my skills going. But what is frozen sections? Well, somebody will go into the OR. I don't know if you've ever had surgery, but they put you on this thing, makes you feel like you're being crucified. You got a cross-like thing, you're on there and got your hands strapped down and wires going in here and things going up there and stuff up your nose and everything. And the doctor comes in, are you comfortable? No, I'm not comfortable. I got a tube in every orifice. But they're doing this. They have to get you ready to do the surgery, and surgeon will put you under, start doing this thing, and all of a sudden they found what they're looking for. But now they got to know whether what they're looking for is, well, let's say they're looking to see if lymph nodes have cancer in them. And what that will tell you is if you have cancer somewhere and it's spread around, then that cancer has become what's called metastatic, and the tumors are going around your body. Well, they want to check that out and make sure, because if the tumors are too far, if the cancer is too far gone, they're going to sew you back up and send you home, and you spend the last few years of your life, or the last few days of your life, or last few months of your life. Otherwise, they repair, take the tumor out, fix whatever's wrong with the cancer, but they got to figure out what it is. And they want to figure out what it is now. So while this patient's on the operating table with their oxygen and, the whole 9 yards, a piece of tissue will be taken and it's sent to pathology. And standing there is a pathologist assistant with the mask on and all ready to go with a piece of equipment called a cryostat. And you take that piece of equipment, you put that little piece of tissue in the cryostat, and you freeze it with CO2 and or nitrogen, whatever, frozen nitrogen. And then you take that piece of tissue and you cut it. You have to use a microtome, what's called a microtome, and you're cutting it. You're making a tiny little ribbon, they call it. And you take that ribbon and you put it on the slide and you fix it, stop it from changing. And then you stain it. And then you look at it under the microscope. And then you give it to the pathologist to look under the microscope. And then the pathologist calls the surgeons and says, this is the diagnosis. And all that has to happen in less than 15 minutes because the patient is still on the table. And you got to be correct. Your diagnosis from the tumor has got to be right on. You got to be correct. As far as autopsy is concerned, I think a lot of people are interested in the forensic side of things. Now I'm going to tell you what I know about most places. I've been in the autopsy suite at St. Vincent's. I've worked in St. Vincent's and at Yale. I've been in maybe 15, 16 other hospitals around the country and visited or gave lectures or at one point, not now, but at one point in time, I was kind of well known in the industry. And I could still be well known in the industry, but I decided that's not my bag. I get most of my satisfaction out of just teaching and going shooting and doing other things that are fishing and other things that are fun. But anyways, and then I've been in medical examiners offices all over the country doing the same thing. I trained a few of the medical examiners out there on how to do autopsies, believe it or not. My favorite medical examiner's office is, I like Connecticut, but the Miami-Dade medical examiner's office. If you know anything about Miami, oh my word, they are the busiest place around, and they got every kind of thing rolling through their office that you'd ever imagine. But there's a difference between a hospital autopsy and a medical examiner's autopsy. A hospital autopsy, the main goal is to find a cause of death. The medical examiner's autopsy is to document the extent of injury. So you have two different focuses going on there. They're hand in hand. They go hand in hand. You can document the extent of injury in a hospital autopsy, or you can document the extent of injury, or you can find a cause of death in a medical examiner's autopsy. I'll give you an example. We get a body down from the floor, someone who died on the floor, been in the hospital sick with melanoma, which is a skin cancer that went metastatic and went all throughout their body. And we know there's a melanoma in the body, but what we do is do the autopsy, document the melanoma, and then also document anything else we find. Could be past injuries, could be other disease processes. Where in a medical examiner's office, the body comes in the front door, and the first thing they do is do trace evidence, especially if it's a homicide or a suicide. They do strict trace evidence on the body first. It's probably clothed. Most people that go in the front door will be clothed. So the evidence technicians will get there with their tape and their vacuum cleaners and every other thing they have appropriate for the case. And in the process of collecting the evidence, they'll take off the clothes. And during the process of all of this, they're also taking pictures. They take pictures of the body clothed, they take pictures of the body without any clothes on, and then they wash the body down afterwards, and then the body goes into the medical examiner's office for the internal examination. They do an external examination and an internal examination. External examination they do before the body's washed off. And after the body's washed off, it's sent inside. They look at the body. And I say, in my view, that when they're doing that, I say that's when they count the bullet holes. So you got 1, 2, 3 bullet holes. And believe it or not, there's cases where, it's hard to tell what the person died from, even though they got shot. How many bullet holes? How many entrance wounds? How many exit wounds? And it's very important stuff because after you do the autopsy, you got to go to court and tell the judge this is what you found in the autopsy. So what's most important is documentation, and that's where photography comes in. You have to be a photographer. You have to know how to. Who knew that taking pictures of fingerprints was an important thing, and the like. Let's see. Once the body goes in on a hospital autopsy, the body will be clothed when it's put on the autopsy table because you're not looking for evidence. You document the clothes that are taken off. You do the external examination. It's a 52-year-old, well-nourished male with this, that, or the other thing, scars, and the like. Sometimes a person will come into the emergency room from a car accident, minor car accident, maybe some physical damage, and the person will go to the OR and they die or they come out of the OR and then they die a day later, 2 or 3 days later. In that case, the medical examiner is not going to order an autopsy, but the autopsy would be done at the hospital. Short of doing an actual lecture for you guys, I was hoping that many of you would be able to tell me what you want to do, and in the world of forensics, and I might be able to tell you what I know about getting there. So somebody ask me a question, and I can talk forever and ever on it. Anybody in the crowd got a question?
I've seen the job of forensic technician, and I was wondering, I was interested in that, so I was wondering what that job entails and what are the steps I should take to become one.
Right. Well, a forensic technician can be a bunch of different things, but usually a forensic technician is another word for an autopsy tech. So in the hospitals, you're going to have autopsy technicians. That's how they're going to be labeled. And in the medical examiner's world, that same person is going to be called a forensic tech. And what does a forensic tech do? Well, let's give you an example. One of the busiest medical examiner's offices around, other than Connecticut, is the medical examiner's office in New York City. All right. You got one in Manhattan, you got one in the Bronx, you got one in the Queens. Now, I spent a month in the one in the Bronx. I spent a couple of weeks at the one in Manhattan, learning and teaching new things. And what the technicians in Manhattan do, get this, they come in the morning, they do an inventory of all the new bodies they got overnight. They line up which autopsies are going to be done. They put the bodies on the table. They take out the brain. And then you don't see them again until the autopsy is all over. Okay? Once the autopsy is all finished, the autopsy technician will come in, clean up the body, do what they got to do to wherever the local funeral home's looking for, and they take the body and push it off on the table. That's in New York. The autopsy technician the forensic technician has very little to do with the actual autopsy. They're cleaning, and which is a very, very important job. You're doing 9 or 10 autopsies a day, and the morgue is sometimes decomposed bodies and every other version. If the morgue isn't taken care of properly, you'll have a really smelly place, and nobody wants to work in those kind of conditions. Now, if you go to to the medical examiner's office in Connecticut, what do the forensic technicians do there? They do the body on the table, they do all the thing to get ready to do the autopsy, and then they actually get in and remove the organs and hand the organs to the doctor. Okay? A whole lot more responsibility. You need to know a whole lot more. You need to learn a whole lot more, like anatomy and how to do an autopsy and how to not screw things up. That's the biggest thing. The doctor will throw the organs across the room. You handed them the organs, not removed properly. It could get pretty crazy, especially when you're working under a lot of pressure. But it all depends on what state you're in. It all depends on what medical examiner's office. I know the medical examiner's office in Alaska. I knew all these guys because I used to go to conferences with them, right? And, their autopsy technicians, forensic technicians up in Alaska do everything, including going out on the scenes and picking up the bodies. Now, that's another thing that is different in some places. In Connecticut, the forensic technicians do go out on scenes and pick up bodies. They bring the body back to the morgue, and they participate in the autopsies that are done. Some places not. So it's one of those kind of jobs, though, that hire you off the street, literally. I mean, you come in, you walk in, you say, okay, I graduated from UNH with a bachelor's degree. I took Art Belanger's forensic pathology class. That might help you. And I'm interested in doing this job. But you want to know, get to know someone. Now, how do you get to know? Well, you could do an internship. Well, with COVID, oh my God, the internships are a mess, right? Yale used to have a great internship. When I was there as a manager, there was at one point back in 2011, I had to cut it back. We had like 8 interns at one time. I was saying, yeah, come on, because everybody was doing so well and they loved it so much. As a matter of fact, all the technicians at Yale, all the autopsy technicians at Yale are UNH students, are people who used to be in my class, believe it or not. And they worked out pretty well. So, I mean, as being a technician, it's a really hard job. It's not the most respected job in the building. All right. What are you looking for when you want a career, when you want to work? The other thing about an autopsy technician or forensic technician is, it's like I was telling a person the other day. She was telling me that she got a job offer at. She got a promotion offer at Stop and Shop. This lady I know, she works behind the deli. Great job, does a great job, cutting meat, doing the produce, all that other stuff she needs to do. And she said to me, she didn't know whether or not she was going to take the job as being a manager. Well, the way I look at things like that, I say, look, if you want to someday be vice president of the company, in other words, you're not going to be satisfied just cutting meat at the deli, then don't take the manager's job. If you take a manager's job, what you want to do is you want to use that as a stepping stone to the regional manager and use that as a stepping stone to a vice president, and blah, blah, blah. A lot of people don't want to do that. What stepping stone do you have from being an autopsy technician? Well, one of the autopsy technicians at Yale, she's been there for probably about 8 years or 9 years. She now also works in the laboratory as a med tech. That was a step up for her. She didn't want to give up autopsy, though, because autopsy is fun. For people like us, it's fun. if I tell that to the guy walking around on the street, I said, oh yeah, I did autopsies for 35 years and it was a lot of fun. They'll look at me like I'm some kind of morbid, macabre weirdo. But people like us, we love doing autopsies, you know. That would be the thing that we would get up in the morning to go do. But what kind of, what kind of future do you have in that? Well, if you want to be an autopsy technician for the next 35 years, some people be really satisfied with that, and there's nothing wrong with that. But it's not the most respected job in the building. What is the most respected job in the building? Well, as you go up in respect, you need more experience and education. That's just the bottom line. You just can't walk in there and say, you have to respect me because I'm cool or I'm special. My mother told me that. It's just, what are you bringing to the table other than a great attitude? I remember one of my techs saying, oh, she wants to go to Mars. And I said, you're going to go to Mars as a colony, to colonize Mars? You're going to go there and not come back? She says, I would do that. And I said, well, what would you do there? There was a silence. What would you do there? Well, I have a bachelor's. Yeah, but they're not looking for bachelor's degrees. They're looking for people with PhDs. The guy who sweeps the floor on Mars is going to have a PhD. You're not going to get to, this fantastic job without having some credentials, without being something other than just a human being showing up. A warm human being showing up is cool at McDonald's. Nothing wrong with working at McDonald's. My first job in the world was McDonald's. My first job was working at McDonald's. That should be everybody's first job. But you don't want to work at McDonald's for the rest of your life. Maybe, I don't know, you might want to, but that means that limits you. As an autopsy technician, you're possibly limited. Many people use the autopsy technician job in the past that I've run into as a stepping stone to something else. People have gone into nursing. People have gone into radiology or something else. But like you get a job, you start learning things, and then maybe that helps you direct you to another place. You're in a building as a technician. Nothing stops you from going around the building and finding out who does this job and who does that job and how did you get this job and this turns me on, this turns me off, that kind of thing. For the longest time, I wanted to do photography. And not just photographing dead bodies. I wanted to go out on scenes and do photography. And then I found out, well, you have to know what you're doing. You just can't show up with a camera and say, oh, I want to do photography. I'm a great autopsy guy. They'll say, well, do you know how to take a picture of a fingerprint? No. Do you know how to take a picture of a tire tread? Oh, I could learn. Yeah, anybody could learn. What makes you so special? Well, what makes you so special is you went to school for 4 years and you majored in photography. That's the difference. So what do I recommend? If you want to, as a young person, dive into it and get you got to find a job as a technician that actually does the pathology work, that actually gets in there. I couldn't work in New York. I wouldn't want to work in New York under those conditions because all you do is put the body on the table, basically, and you walk away. You don't do anything else. Where at Yale, the technicians are actually helping the residents learn how to do portion of the autopsy. The technicians, are skilled people. They have to know, how to take the organs out of the body, how to put the organs, get the ready for the doctors or for the PAs. Myself, if I did an autopsy myself, or I did an autopsy to show a doctor how to do it, the technician was part of the routine. The technician would stand right next to you. And it's a lot like being in the OR. You've got 4 hands instead of just 2. So the technician would follow the prosector. So the person like the doctor or the PA would be what's called a prosector. person doing the cutting. And the technician has to know what you're cutting next, what organ's coming out next. So, a technician, an autopsy technician in a hospital versus a forensic technician in a medical examiner's office, they're basically the same kind of person, but they can do a lot of different jobs. Did that answer your question? Yeah. All right. Who else has got a question or something that I can talk about?
I wanted to ask about ways to get ASCP certification. I've looked at a lot of jobs over the last year or so and internships that look for either ASCP certification or other related ones like medical lab technician or medical lab science and so on. What is your knowledge or what is your advice on going about like the educational programs to get to that certification?
Right.
Yeah.
Well, the American Society of Clinical Pathologists, that's the ASCP. They're the certifying agency for the laboratories in the medical side of things. Whereas in the, like in forensic side, you have NAME, NAME, the National Association of Medical Examiners. I don't think they have any specialized for technicians in the medical side of things. They do have for forensic investigators. Now, some places may have technicians that double as investigators. I'm not sure of Montana and California and some of the states, but you've got there could be you could be a forensic technician, and that forensic technician can also double as an investigator. And you get your certifications through the ID something or other. I forgot what it's through. As far as ASCP, they certify everybody. So pathologist assistant, you'll notice on anybody who's a laboratory certified, they'll have their name and then they'll have their credentials from college. And then they'll have the ASC certification. ASC certification, like for me, it's PA and parentheses ASCP. That's very simple. You could be a cytotechnologist, a histotechnologist, there's a gazillion different things, and then there's subspecialties. Anytime you get a job in the medical pathology field, you look for something to get certified at, because that's what raises your value in the laboratory, being ASC certified. So what is it? Probably the easiest thing to get ASC certified on would be, from the beginning, would be like a histologist, a histology technician, medical technicians, okay, medical laboratory technicians. These are jobs where you have a minimum amount of education, minimum meaning, usually a bachelor's degree, a minimum amount of education, and then sit for an exam. Have a certain amount of years of experience and sit for an exam, that kind of thing. The trick there is getting hired, as something, in the lab. Now, I'm not sure about the lab hiring any, I used to have my fingers on the pulse of the lab and stuff, but nowadays, no, I'm retired, right? But, you see a job in St. Joseph's Hospital down the street from where you live at home, and it's for an entry-level lab aide. That's the one you want. Unless you have something else set up where you're making big dollars for some state, looking at fingerprints or whatever. That's what I want. You get that job as a lab aide or a lab technician, or they'll call you a lab technician, but you walk in and what you're doing is you're refilling chemicals in machines. You're sweeping the floor. You're doing the grunt work. And let me tell you, the best way to a great career is doing some grunt work at the beginning. Always. We all think we're special. We all think we're, going to walk in and they're just going to welcome us in the office that you're the best thing in the world. That's not going to happen. It's It's not going to happen. Not on your first job. On your first job, you're going to get in, you're going to have to grunt it. You're going to have to do the work that other people don't want to do in the lab because somebody's got to do it. And it can't be always, some guy they drag in off the street that's half drunk half the time. I mean, that's when I first got in this business, that's what they used to do. They would just grab anybody they could and say, here, empty these buckets every 5 hours or something, and that's all the person had to handle. But today you've got to take on multiple jobs. So even as a entry level at the quote lowest level in the laboratory, there's a lot of responsibility put on you. And the more responsibility you take, the more you'll get. The more you get, eventually, the more important you are, the more you have to offer. Right now you graduate from UNH. Let's be honest. What do you have to offer? You have this basic education, better than no education for sure, and it's a quality basic education. But everybody's got that basic education. So the relativity comes in there. Everybody's starting where you're starting. If you want to start on the technical level, you get yourself in there, take any job at all that can get you in the laboratory, and then you work your way up from there. Because God is my witness. You'll walk in there, and within 4 or 5 months, you'll see a job opening for another part in the lab, and you say, "Oh, I'm gonna jump on that med tech." Oh, well, maybe. All right, you have a bachelor's degree. Okay, so now you have to have documented so many hours or so many months doing this and so many months doing that, or you have to take this course or you have to take that course at night. You work your ass off, and the next thing you know, you're a certified med tech. And at the end of your name, you have MT parentheses ASCP. Now, the thing about the ASCP is they also have certification maintenance. So if you see somebody that says MT and it's got ASCP and then a little tiny superscript, up above the ASCP, it says CM. What that means is they passed the exam and they maintain their certification over a period of time. And maintaining the certification means you have to go to conferences, you have to participate in training, you have to do this, and you have to get a certain amount of points. For a PA is graduating today. They have to get 60 credits every 3 years. Now, my certification's up in September, and because I'm on the old school, this time only, my certification, I need 45 credits. How many credits do I have right now? Zip. Why? Because I retired. But I can get on the ASCP website, read articles and answer questions. COVID screwed up my trip. I don't know if they're going to have it this year, but usually I go to Colby College in the summers for the Northeast Regional Forensic Science Conference. And that gets me 25 credits. Well, if you're a med tech, okay, to maintain your certification from the ASCP, you've got to take so many courses, sit through so many lectures, read so many articles, and all that is done through the ASCP. I think it's a great organization. There's politics in them, so you stay out of the leadership. If somebody says, "Oh, don't you want to be this or that?" No, I don't want to be any of that kind of stuff, unless you're into that. The other type of certification they have is subspecialties. So once you get your initial certification, you can get subspecialties, which just make you more valued in the laboratory. And once you start your subspecialties, then you start thinking you're valuable in the forensic lab too, because it's all about the testing of the lab, the certification of the lab. You walk in and you have your lab certified, or you walk in and you have your yearly or bi-yearly exam tests for what's the word I'm looking for? Not certification, but I don't know. A toxicology lab that's putting people in jail based on the toxicology report. Your reports have got to be good, and you have to be certified. I don't know how often they do it in the medical examiner's lab, but in the medical lab, they do it every 2 years. Every 2 years, they have an ASCP inspection, CAP inspection, I'm sorry. And the CAP comes in, and that's peers. They go through, they make sure all your reagents are up to date. They make sure all your safety's all done. Well, you can get specialties in safety, you get specialties in lab management and all this other stuff. You can make yourself very valuable. Now, who's the person that says this stuff isn't important? The people who don't have these certifications. You know, I worked with a technician at Yale, and he was one of these old timers, been around for 100 years. What are you getting all that education for? You don't need all that education, you know. I don't know if you guys have heard that ever. What are you going to college for? Well, I'm not a plumber, I'm not a mechanic, and I'm not a carpenter. I haven't got those kind of skills. And it's only people who don't have an education, they're going to tell you you don't need an education. You know, most people, you get training, you get certified, that makes you more important. That makes you worth more. Not more important in that you're better than anybody else, but worth more. You can do more, especially when it comes, okay, is this technician certified to do this level of testing? If you got technicians that are doing testing that they're not supposed to be doing, like doing an autopsy is a high level test. CAP comes in and says, who does the autopsies? Well, the only people who do autopsies are the doctors and the PAs. You pass. That's okay. And that section, that's okay. If you had, like, there's a big stink out in the Midwest right now, but this one character who advertised to do private autopsies. And this guy wasn't even a doctor, wasn't even a PA. He was nothing. And he found a loophole in the law because the people were dead. They're not considered specimens, they're not considered people or whatever in that state. And he sucked tens of thousands of dollars from families to do, quote, private autopsies or second autopsies to do things. So, you know, my philosophy is certifications are important, especially beginning your career. I think that they're one of the most important things to do. Other people say, he doesn't know what he's talking about. But, you know, that's just my experience. I think it's very important. Who else has got questions?
I do. Sorry for the music in the background, but so I was wondering what would set someone apart if they're going for their PA, because I'm applying for the Quinnipiac's program.
Oh, congratulations.
Thank you. I'm still working on my, letter of intent and all that, but I was wondering what the programs would look for that would set someone apart.
Who are you? What's your name?
Erica.
Oh, Erica, you're in my class?
I was in your class.
Yes, you were in my class. Well, putting down that you were in my class is one good thing.
Definitely, I'll put that down. But I was just wondering, what kind of experiences or like something that would set me apart, because everyone's going to have good grades. Quinnipiac is not looking for GRE scores, so what I don't know if you know, but like what would set me apart from another candidate?
Well, it's just like medical school. What's the number one thing they look for? Can anyone tell me what the number one thing they look for when you apply to medical school?
Grades.
You'd think, right?
Well, I've been told recently that it's not grades, that it's like the experience and all that and what you've done.
Partially. But you got to understand, those people sitting at that table, choosing, making the decisions, their number one concern is, will this person finish the program? That's their number one concern. What's going to plant the seed in their mind that they'll have the confidence that once they bring you in the door, you're not going to go out the door after 3 to 4 months. Okay. That is a very difficult situation to be in. At Quinnipiac, they have very few people who drop out of their program. Why? Because they make sure they want to get people in the program that they're really sure are going to make it all the way through. And make it all the way through. Well, the first year is nothing but classroom. And you proved you can make it through classroom. You get a certain grade point average, and you know, they look at your manuscript and your not manuscript at your
transcript.
Transcript, that's the word. Sorry. They'll look at your transcript and they'll say, "Oh, no dropped courses, no withdrawals, no incompletes." These are the kind of people. You know, you if you go up there with your transcript and it's full of voids, you know, they may question whether or not you're going to be that committed to do it all, because in the second year, the first year is relatively easy. I mean, it's hard mentally and educationally, knowledge-wise. They pump a lot of. I mean, those classes I've sat through. Oh my God. You know, I give a quiz almost every class, and I learned that from one of the instructors at Quinnipiac. Without the quizzes, there was no way I was keeping up with all the material they were putting out. It was just beyond me. And there were sometimes I'd sit in that class and I would think, there's no way normal people learn all this and keep it in their minds. But it is. It's true. You can learn all. So that's first year is not the big deal. It's the second year when they throw you out there in the lab and you know, short of the first month you're out there, they expect you to be the kind of person that can perform. So what you want to do is go deep in your heart and say, okay, could I perform knowing the basics but being under pressure? And then if you're confident that you can perform knowing the basics but being under nothing but the basics, but being under a lot of pressure, you can perform. If you know that, if you have confidence that you can do that, then you have to relay that confidence to them. And you say, you know, I was challenged this way in my life and I made it. You know, I did this whatever thing. It took a lot of effort and a lot of repetitive work, and I did it under a lot of pressure. That's the kind of thing that's going to stand you out from the crowd. You know, anybody can, you know, volunteer to do this, volunteer to do this. You know, I used to ask some of the docs how they got into medical school. One guy, he used to tell me he used to volunteer to feed the animals at the local zoo. And that doesn't sound like a crazy thing, but he had to go to school and learn how to feed the animals, and he had to do this and he had to do this, and he did all that just to volunteer. And that's what stood him out, and that's why he got into medical school. You know, it's you're proving that you have, you know, the gumption. And you talk to any of the second year pathology assistant program students. When you apply, when you put your letter of intent and, you know, you put your recommendations in and all that other stuff, you want to try to get in to where you can talk to some of the students. And all you have to do is ask Robert. I think Robert Cantrell, I think he's still the director over there. Say, Professor, is there any way I can speak directly to some of the students? Can I see? Because what you want to do is, what they used to do was they would send prospective PA students to me. They'd call me up and they'd say, "Hey, Art, I got a student here who's applying for the program. She wants to make sure she can, you know, deal with autopsy. I mean, you know, the worst case scenario is the first autopsy you see and you pass out. You're in the wrong business." And it's happened, though. It's happened. You know, and I used to get these people, prospective PA students. So you make sure you tell them, I want to meet with a PA and see about their work and how hard their work is. You know, a lot of people think that the hardest work in a PA is on the bench in surgical pathology. That's where most PAs spend most of your time. You know, I was one of the oddballs, but there's a few oddballs out there who just do autopsies, not just me. There's a lot of PAs do surgicals and autopsies. But you want to get out there and look at the surgicals. Are surgicals any less exciting than autopsies? Absolutely not. You spend your day just surrounded by medical stuff and surgical stuff, and you're right up to your elbows in the middle of it. And if that's what you're interested in, my God, it's all there for you. And then you could do research, and you could do this, and you could do that. It's amazing. You guys have got to write a note, and you'll see how I got involved with something towards the end of my career was pig brains and doing study to how long brain cells live after life. This is zombie shit, right? And it was written up in the New York Times Magazine. All you have to do is Google New York Times Magazine and pig brains, and an article will come up, and you read the article and you can see what role I played in it. But you know, those are the kind of things you could do. You get yourself thrown in. But those are the kind of people they want in the PA program. They want to make sure that, all right, I'm showing up with a 3.6, a 3.8, whatever. Okay, you know, then they know you can make it through the classroom portion. It's that second year. Are they confident to make it through that you'll make it through that second year? And somehow you've got to instill upon them that you're confident that you can do that strenuous, well, not physically strenuous as much as mentally strenuous and dexterity wise, cut surgicals. First day, they're going to throw you 1,000 biopsies. You say, I got to do this week. No, you got to do the 300 of them a day or something like that. And then before you know it, you're so used to doing it that you do it with your eyes closed. But and then eventually you graduate away from biopsies, which are nothing. It doesn't take any brains. You could teach them, you know, you could teach anybody to do biopsies. And after you learn how to do them, a technician steps in and does them. So then you move up to more complicated specimens. Look at the job applications for PAs, okay? And in there, they'll say, oh, no weekend responsibility. Some of them say no autopsy responsibility until you get there. And then they'll say special cases, complex cases, everything. And that draws people that make good PAs, is to understand that on a daily basis, they'll be doing the most complex surgical cases that there are. And that makes you why is that so important? Well, it makes a PA a respected person. What's everybody want in the workplace? You want respect. You know, when you don't get respect, let me tell you, you know, it hurts. It hurts your feelings. It hurts inside. And some people say, well, you know, I'm going to demand your respect. You're not going to get it by demanding it. I don't care how many credentials you have. I don't know what, you know, I mean, respect is earned, and people respect the guy that sweeps the floor and they respect the guy that cuts surgicals, respect the girl that does this or that. It's all about respect. You want to have respect on a job. You want to have respect as a student. When you go to apply at Quinnipiac, you say, you know, I can do this stuff. I can do this stuff. I have it in my heart, and I've done this. What's this? Oh, write a journal article that took a little bit of work to do. You're all juniors or seniors? For the seniors, I don't know, you still got time. I don't know what your workload is though, but how many undergraduate studies have you done or articles have you written? I'll tell you, that makes a difference to people, especially in the lab. Oh, you did a little research article on something. Is that question,
Yeah, it answers it, but in the process, I've come up with another one. So I've been looking for some sort of experience in the meantime, which was very hard to do just because of COVID.
Yeah.
I did shadow a pathologist, so I did see an autopsy, and it was great. No blunt force trauma there on my end. But my question was, if I can't get like autopsy technicians, I've been looking for just to apply for, just to gain experience and have something to rely on for now until the year starts. I was just wondering the difference between autopsy technician and like a mortuary technician.
Same thing.
Same thing? Okay, cool.
Same thing. It's
Gotcha.
basically the person that they're going to call upon. No, what I used to say is an autopsy technician is a person who can do anything in their realm. So you walk in the door the first day, and the only thing you can handle is sweeping the floor. I mean, let's be honest. You walk in there and say, okay, well, I know how to use a broom. And you look over, and there's all this equipment around and scales and everything. You don't know how to use any of that stuff. But you learn, and you show somebody you're really willing to learn how to do these things. The morgue is, some jobs they'll say morgue attendant. You look in the job description, and it says, releases bodies to funeral homes, moves bodies around, puts bodies on autopsy tables, cleans up the morgue after autopsy, cleans in the laboratory when autopsies aren't going around. That's a great way to get experience. You know why? Because you're going to be working with technicians, and you're going to be working with pathologists, and those are going to be your future references. Those are the people who are going to say, yeah, this person can do the job, or yeah, this person can continue their education, can do their education. Every bit of work you do counts. Just remember that. And even if you're just sweeping the floor in the morgue, because you're only going to be sweeping the floor for a couple of days before you tell somebody you know how to do this, or somebody says do this. They look at your willingness to do the job. I think it's a great job. If you see a job as for a morgue technician or an autopsy technician or a forensic technician, and you think you can apply for it and get it, why not? Just apply for it. It doesn't cost you anything. You never know. You never know that you might walk in for your interview, or you may do an interview online like we're talking right now, and the person that's talking, you say, I got to have this person. It will, and you'll never get it if you don't apply for it. That's for sure. Okay.
Agreed. It's just hard at the moment because everything is closed due to COVID, and I've applied for some jobs through the OCME in Manhattan.
Mm-hmm.
I'm based in New York, and I've applied in like December, and I'm still waiting for a response.
Yeah, it's tough. I mean, COVID has ruined everything for everybody. Imagine you were a high school football star, and right now, or a lacrosse star or something. Just this whole thing that with the schools being closed down and with the businesses being closed down. I didn't think it was going to happen this soon, but the CDC has come out and said once you get your second vaccine, 2 weeks after you get your second vaccine, you don't have to wear your masks anymore. You don't have to social distance anymore. And it's only going to be a few months before all that is done. And I'm kind of telling people, this whole year was just a waste for everybody. This whole year was just a waste. I can't wait to get back to teaching in the classroom. I was teaching at Quinnipiac, but this whole thing caused Quinnipiac to let all their adjuncts go. And how do you function without adjuncts? They're not doing very well. And so, yeah, it's bad. It's bad. And I think everybody in this class, anybody who's listening to me, you're taking, you've been dealt a bad hand of cards this time, because of this COVID thing. No solace, but everybody's in it, and that's going to be the excuse for years. It's going to be, well, I couldn't do this because of COVID. I couldn't do that because of COVID. What could you do in spite of COVID. That's going to get you in the door too. What are you going to do in spite of COVID? You still manage to write an article. You still manage to do whatever. You have to use your imagination sometimes. Anyone else?
So I know you said like everyone's mainly seniors and juniors and they kind of have like time and they're doing their stuff now with COVID. But I'm a sophomore and I kind of just discovered that I want to do pathology. And at first I actually did not know there was a pathology professor, so I was really excited to like get that email and stuff.
Cool.
But my questions are like, how would you say, I know like I'm still early on and I still have my junior and senior year, but how would you kind of set that track for us? Like, what would be the first step? Would the first step be taking your class and learning about everything?
Of course.
Would it be trying to like you said, it's never too late. It's never too early to get like those small things and those small jobs.
Yeah.
So like, would I still look in things like that?
Yeah. Okay. So you're a sophomore. Have you taken anatomy and physiology yet?
I did in high school, but not in college.
Oh, take it then.
Mm-hmm.
Take anatomy and physiology, take any kind of laboratory course, like not course that has a lab, but I think, I don't know, do we still have a microbiology course?
Yeah, I'm in it right now. That's a good class.
Biology and a microbiology. And also they started like a immuno something.
Oh, good. Yeah. And what's the future in pathology and in forensics? What's the future? DNA, molecular. Take as much molecular courses as you can, because like in pathology, everything is all on molecular science now. It's getting so detailed with, identifying tumors by their molecular structure and treating them because of their molecular structure. But you want to take the basics, anatomy and physiology, get that out of the way. Take the microbiology course, take the forensic biology, and take forensic pathology. And that's what you could do for sure. And then because you're a sophomore, hit your advisor up about projects you can work on. There's got to be something you can. I used to say, and I don't know how politically correct this is anymore, but I'm going to say it anyway. You got a field of people in gray skirts. How do you have the red skirt? How do you stand out from that people? Everybody's got the gray skirt, but you want to stand out. You want to be, you want to be noticed for the good. You want to be noticed for the good. So what can you do? And some of the things that will make professors and others, those in academia, pay attention to you is things that you do on your own. That's research. Find a subject that you're super interested in. Go to the forensic journals. Your AAFS, your American Association of Forensic Science. The journals there, I think they have student memberships. I think you should get in on the AAFS and look at the studies that are going on, and maybe you use your imagination and get something going. It could be a little thing. I had a student. I got this thing. Where is it? I can't put my fingers on it. A few years ago, I had an engineering student come up to me and said, "Do I have any ideas for him?" I said, "Oh my God, I don't know." And I said, "What are you working on?" He was working on some software and some project that looked at the conditions inside of pipes when oil went through them. And I says, "Oh my God, atherosclerosis, hardening of the arteries." Okay. If you take and look at hardening of arteries like oil pipes, and take this, and he ran with it. He was able to show and did a whole project on how just blood traveling through the arteries damages the walls of the arteries. And I think he was the highest graded student in the whole school or something that year. This was a few years ago. So, I mean, there's little things you can do that would really make a big difference. But you got to do it. It's got to come out of your brain. And, somebody can come up to you, some doc or professor can come up to you and say, well, yeah, here, do a project on this. Um, there was one project I was working with Professor Palmbeck and some of the students on degradation of DNA in salt water. It was a wild project, but think of something that you could start in your sophomore year and start working on. Go to your advisor and say, look, I want to work on something. I want to do something. And what you got to do is thumb through the articles in the AAFS journals and get some ideas on something you may want to find. It may even be you're doing a review of articles. I was reviewing articles and on the ASCP website about COVID. The first articles about COVID were written when nobody knew anything about COVID. And so now you could go back and review the articles from the beginning of COVID. I'm giving away a project here. Take the articles that are written about COVID from February of last year and compare them to what's going on today. And you can write write a paper about an article. Don't call it a paper anymore. You write an article about, or you do a project about how our knowledge of COVID has changed just over the last few months. And if you start thinking, sit down with a bunch of your friends and start throwing ideas around, you'd be surprised you could come up with ideas on what to do. Okay. Sophomore, I want to see, what's your name?
Renia, and thank you.
Yeah, I want to see you in my class. I'm hoping maybe next spring, because I do in the fall and the spring now, because it always fills up, which I love it. I love it so much. Maybe next spring we'll do it in person. I can't wait to stand up in front of the class in person again. I missed that.
Hopefully.
Who else? Who wants to talk, or are we going to be done? Geez, look what time it is already. We did pretty good. You said an hour and a half. We did it. So does anybody else have any questions or anything for me? If you do, feel free to contact me via email. You know how to do that in the school. And, it was when I got invited to talk to you guys, I was, it's an honor for me to come and talk to students that are interested in this stuff. I love to share my stories in the class. I've got a gazillion of stories. You ask me about how someone has died, and I'll tell you a story about it. It's happened here in Connecticut anyway, maybe down in Miami. But yeah, I've done a lot of wild things. When I think back at it, I was like, oh my God, what a business this is. And you guys are just getting started in it. I kind of envy. Would I like to do it over again? Sure. But if I did it all over again, if I had a chance to do this whole thing all over again, I think the number one thing, they say if you say you're humble, you're not, but if you try to be humble, the problem with trying to be humble is you very seldom get any respect. And you have to weigh humility and respect and being famous. I've been famous. It wasn't all it counted. It's not all it cut up to be. I've signed somebody's books. I've done articles in magazines. I've done books on, contributed to books. And you can do all that stuff because I'm not that special with this stuff. I'm just another character. But there's a few places I can shine above others, and there's few places you could shine. Don't let people tell you you're being overambitious or anything. Just get into it. You throw your heart into it. Be a passion. Have a passion to do this stuff. Nobody can fault you for it. Nobody. And then you don't have to worry about anything because you're become an important person. Thank you all.